Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Well, good morning and thank you very much for sticking around to Good Morning Uganda. Now we are off to Good Morning Uganda Extra. Earlier on this morning, we had a report coming in from the press review that we normally have at the start of the show. That is around 6:30 to 7 for those of you who are just joining us now. And with the Daily Monitor today at the front page, there is an interesting report coming in from Uganda's health sector. And that is where we are going to be driving our conversation here on Extra, as we look into the health disparities within the country. Now, this interesting report is on page 8 of the Daily Monitor, and it's highlighting that there is an audit report that has further exposed regional imbalance in drug supply. Now, the bigger question is, as we are going to be looking deeper into this very report to see which region seems to be benefiting from the supply of drugs and which regions seem to be missing out on the same. So welcome on board to Good Morning Uganda. You can as well be part of this conversation by sharing what you think should be done to ensure that we have a regional balance of medical supply within the country, because as we do speak and what we do know so far is that at least the health sector in Uganda is one of the priority sectors every financial year, because without health, then the wealth cannot be created honestly. That is why you get to realize that many governments, not only in Uganda, but world over, pretty much put a lot of emphasis in promoting the health sector. Now, joining me this morning is a colleague that I do work with every morning here, Robert Chirabo Nyonyintono, as we get into understanding what is the main cause of these disparities, and then how do we deal with these disparities? What should the different bodies in Uganda do? Yet again, which bodies are responsible for what in Uganda's health sector? So that is the conversation, quite open to you, our dear viewer, this morning. And again, thank you for joining us. Robert, an interesting one, and coming in from Uganda's health sector. You know, when it comes to Uganda's health systems, I think we've all had a fair share of positives and the negatives.
Yes, definitely.
But let's first of all get into this conversation, the disparities.
Well, first I must say it's just that they looked at the health sector. But when you look at all sectors, there are these disparities. When you talk about, I think the only area where you won't find these disparities could be security. That generally, if you are to look at region by region, you find that
security is tight everywhere.
Because now we can't talk about a serious rebel group in a particular area. Like we had the Lord Resistance Army in North, and one would say there's disparities in security because when northern Uganda are not sleeping, there's the Lord Resistance Army. When you talk about education, look at these national exams we have. Look at the education system. You can't tell me that people in Kampala, people in the central region, or in the Near East, or in the West have the same as North and maybe the other southern part of this country. So these disparities are there in different sectors, just that now I think the report factored in particularly the health sector.
And just quickly as well to your dear viewer, as of 2020, that was during COVID, the World Health Organization had reported that Uganda had a shortage of essential medicines with an average stock of out of rate was about 45%. That is of out of stock for drug supply. Then, and only 20% of health facilities in Uganda had consistent supply of essential medicine. Now, this was a report by the Ministry of Health in 2020, that out of all health centers within the country, 20% had constant supply of this. And then at the top of it, the country has also had a high burden of quite a number of diseases, malaria, HIV, tuberculosis over the years, and one would expect we should not be running out of drugs for such diseases that seem to be taking millions of Ugandans year in, year out. What do you think is causing this issue, Robert, of having, different regions or having regional imbalances when it comes to supply of drugs?
One, we must also first understand that where do we get the source of our drugs? You must be very cognizant of the fact that most of our health sector relies more on our donor partners. Talk about HIV, over 80% of the budget and the input in HIV/AIDS is donor funded. Talk about the malaria control program, donor funded. I think the area where we have not seen so much of donor fund could be the cancer sector, Uganda Cancer Institute. Maybe they have some, but when you look at our health sector, a big chunk of monies, a big chunk of programs in our health sector are run by donor support. Now, if you're talking about donor support, I just want to take Ugandans back. We had just passed the anti-homosexuality bill. His Excellency, in a speech, if you remember very well, he mentioned that you cannot risk, I think, the 1-point-something million Ugandans accessing ARVs, accessing HIV treatment because we passed such a law. That was showing how deep our health sector is relying on donors. Now, when tensions are high, donors in one way or the other cut aid. Now, if majority of your supplies were relying on donor fund, that is an obvious decline, that you won't have that. But also, we must understand that much as we've committed and we are signatories to some international conventions, pledging and promising that a certain percentage, I think it's 15% of our budget would go to health, we are not yet there. Debt servicing takes a good portion of our national budget. We go to human capital development. These are priority areas. Infrastructure, one would say, it's not only roads, maybe even that would involve building more hospitals, but still our commitment of the percentage of our budget that we are giving to the health sector is still very wanting. Therefore, if your budget is very wanting, the percentage that goes to health, sometimes you say health is a priority, health is a priority. Yes, it is a priority, but what is making it a priority? Donor money. Not so much is our national money. All these are programs. Now, it would be a priority when we look at our budget allocations. Is 30% of the budget for the financial year 2024-2025 going in the health sector? The answer is you don't have even 10% of your budget going to the health sector. So that explains why you will have challenges. Now, we go to these disparities. Why do you see that in the central, you may have that 20% of these health facilities having constant supply? One, accessibility or proximity. You have national medical stores, it is there. Of course, they are near, the Ministry of Health is there. The reporting chain is very narrow for someone to communicate drug stockouts. But also the monitoring is very close. That someone to go to and monitor Chirudu Hospital, it's very near, Molago Hospital, someone to go to Chisenyi Health Center, you know, and all these other Chiswa, proximity, they are quite near. And the levels of civilization and ability to demand for services in this area, it is very closer. But not forgetting even the road network. The number of health centers today where it is very costly for the national medical stores and other agencies that deliver drugs to be able to deliver these drugs on time. But I must also be quick to add that even accountability brings in a problem.
Okay.
Let me give you an example. When drugs are delivered at a health center, even the local community is supposed to be aware and even pen signature, the local leadership. But how often do we see this happen?
Okay.
Now, most of the challenge we have today is lack of information. And people use the gap of lack of information. Because if certain drugs are supposed to go to a certain health center, that is in case they have been purchased. They'll tell you we have drug stockouts. We last received drugs 3 months ago. And when you dare to find out why did these people last receive drugs 3 months ago, they'll show you that no, drugs for that particular area, that particular health facility in that location were approved, they are ready, but maybe there was a challenge in transportation or a loophole somewhere.
Okay. And Robert, with me, I do have the copy of the Daily Monitor that I did refer to at the start of our conversation. Now, according to the Daily Monitor, this is a report coming in from the Auditor General's report or assessment report. And this covers trends of assessment of 3 years. That is from the financial year 2019-20, 2020-21, 2021-2022. Those were the 3 years that are being covered in this report. And one may still ask, who is responsible for distributing these drugs? Now, the National Medical Stores is responsible for storing and distribution. Then the National Drug Authority is responsible for checking the quality of the drugs on the market, and then also further regulating in order to create room for safety of the drugs that we do have. Now, the Ministry of Health is automatically the overseer of all these organizations and agencies. But besides that, looking at this report, it shows that Mbarara Regional Referral Hospital is the facility experiencing the least delays in receiving government drugs, while the Kampala-based Naguru Regional Referral Hospital experienced the highest delays. Now, in this report, it shows that the delays or the chances of the Naguru Regional Based Referral Hospital running short of drugs is so high compared to that in Mbarara. Again, now this brings us to the regional kind of imbalances that we do have. Because here there are some regional hospitals that are highlighted in the report. There is Naguru, Mbarara, Mbale, and Masaka, all of these. But at the end of the day, Naguru, which is in the capital, by the way, is the one that is having the least, or is the one that is experiencing the most delays of drug supply. Now, which brings me to the question, Robert, let's look at the responsible bodies. Because if we have these imbalances, like you've shared, you know, we have issues to do with financing, at times even the budget. Now, who are the responsible bodies? How do we find ourselves in such a situation, and how then do we even get out? But who are these responsible bodies?
Now, like you mentioned, you have a government of Uganda, that is the Ministry of Health, at the helm of this. That is to ensure that the drugs are available, they are purchased, they have their procurement department, they arrive in the country. National Drug Authority looks at are they safe for human consumption? The National Medical Stores is mandated to ensure that these drugs now get to where they're supposed to go. Now, I hope they're referring to the Naguru Hospital, that is it Uganda, China, Friendship something hospital?
The one in Naguru.
The one in Naguru. Now, if you look at the history of that hospital, it has government of Uganda and China. Actually, I think that's something, Friendship Hospital. Now, very important to note is there is a hand of donor partnership. And there could be so much that our development partners in this are contributing. Now, I want to believe either the reporting mechanism of the authorities there could be causing the delays, or the assumption that our development partners are meeting certain requirements. I've never looked at the memorandum of understanding between the two countries and what it talks about when it comes to purchase of drugs. But that could also be another element there, because it is very, proximity would not be the issue we are talking about. So there could be issues either of bureaucracy in one way or the other, or issues of how the two people, the two governments running this very hospital, each to what extent must they fulfill their obligation and the other. And that can cause, you know, bureaucracy sometimes can cause confusion and scarcity and delays, unnecessary delays, because of bureaucracy. So I want to believe that maybe there is an element of bureaucracy. I don't want to believe it's someone sleeping on job, but I think it's issues of bureaucracy what do you go through to be able to purchase, to be able, in case you need to do in-house purchases, you know, because sometimes also government buys in-house. What is the budget allocation to this particular hospital in terms of if they are to have a offshore purchase of drugs? So there could be bureaucracy delays. That is my assumption. Yes.
And when we do return after the break, we're going to be having a conversation on what really needs to be done to make sure that we contain this kind of situation in the country. But still, stick around to Good Morning Uganda Extra. I'm here with Robert Chirabo. Good morning.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Once upon a time, there lived identical twins who gave birth to beautiful princes and princesses.
Their mothers gave their babies' bodies a lot of care by applying on their skin with baby junior jelly.
So dried their chariots and everyone would admire their glowing skin. Fun fact, baby junior prevents diaper rash, dry and sensitive
Moms
skin.
all over Africa love baby junior jelly. Baby soothes the skin. No more worries anymore. Boo, 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 boo. Baby junior.
Baby Junior.
Coming soon on UBC.
Welcome to Inside Broadcasting.
Sharing with you the process behind what you see on the screens.
My name is Lorene Masika Kazimoto.
Step behind the scenes and witness the magic that brings your daily broadcasts to life.
That's why I come out openly to actually tell you that I'm an investigative journalist. That even when you see me here, I'm actually investigating you guys. So you should be aware about that.
Experience the hustle, the heart, and the human stories of our on and off-air staff.
I see my phone ringing and I'm like, ooh, which number is this? I hear the president on the other line.
The President of the Republic of Uganda.
Of Uganda, yes.
Be inspired, amazed, and part of the journey that powers Uganda's most captivating TV and radio moments.
Because good broadcast comes down to an individual. They should be artistic.
This is Inside Broadcasting.
Inside Broadcasting.
Inside Broadcasting with Mark Wadula.
Coming soon on UBC.
.3 Kampala, 96.9 Mbale, 95.7 Jinja, 98.6 Soroti. You are all covered.
UBC Butego. UBC Butego.
Juko. Yo. What you check the shopping, man. What's your secret?
Uganda, haven't you heard of the parish development model PDM?
Yes, I did, but I thought it was just a talk.
No, Sebatia. It is real. I and a few friends together formed a circle, accessed money from the PDM, invested in a portrait project, and now things are moving.
Juko. I thought I was one of your friends.
You are.
But you left me behind.
I didn't leave you in poverty. What you do, just visit your LC2 chairperson and your parish chief and start the process of economic transformation. Just like that. The parish development model is an initiative from the government of Uganda through the Ministry of Local Government designed to transform all lives of Ugandans for the better. PDM, my parish, my development, my life.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
We'll be back from the break and we continue with our conversation looking into Uganda's health sector. Now, as we're summing up with the conversation that I've been having with Robert Chirabo just before the break, according to Sheila Nduishire, who is the National Medical Store spokesperson, many of the challenges rotating around the delays in drug supply are majorly because of delays in finance release from the Ministry of Finance, and the others also have entirely been around there, which undermines or which makes it difficult to operate, or by, in regards to operation, makes it really difficult for many of the regional hospitals to have these drugs in time. The beauty is they get the drugs, but at times they run short of the drugs and then they have some delays in the supply. But of course, she further also revealed in the same report by the Daily Monitor that they also, through the Ministry of Health, presented before Parliament their issues, and they await to see how this will be done in regards to curbing the issue of delays in medical supplies. Now we turn our eyes and switch them to a different kind of conversation this very morning, and tell you what, it's still under the health sector, but we are now looking into matters hepatitis, because on the 28th of July, it will be World Hepatitis Day, and Uganda will be joining the rest of the world to celebrate it. However, I've been told by my guest this morning, who I am yet to introduce to you, my dear viewer, that in Uganda's perspective, the official celebrations will be shifted to the 2nd of August. 2nd of August will be a Friday next week. Now, joining me this morning is Kenneth Kabagambe. Now, Kenneth Kabagambe does serve as the Executive Director of the National Organization for People Living with Hepatitis B. He joins us this very morning here on Good Morning Uganda Extra. A very good morning, Kenneth, and thank you for joining us.
Thank you so much. Good morning, viewers.
Well, and with my preamble, I did mention about World Hepatitis Day, and off air, you've reminded me that we have 5 types of hepatitis, bringing me to my very first question. That is, with this hepatitis, what is hepatitis then, if at all we have 5 types? Yeah. Because we are only used to hepatitis B, because it does seem like, okay, we are used to it because it makes lots of rounds in media, yeah, and when it comes to the hospital awareness. But give us more details about the 5 types.
Yeah, thank you so much. Hepatitis, in simple term, it is a liver disease. So it comes from a Greek word which means hepa, which is hepa and titis. Hepa means liver, then titis is disease. So hepatitis is a liver disease, and we are going to concentrate on the 5 types of viruses that actually cause or transmit hepatitis. So we have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. So all these types of hepatitis viruses impact the liver differently, but the ones that actually are of public health concern are 2, hepatitis B and hepatitis C.
Okay.
Much as we have challenges with hepatitis E, especially for pregnant mothers, which can actually cause dehydration and also maybe lead to something like abortion, or so those are some of the hepatitis viruses that we can talk about.
Let's drive this conversation into matters transmission. How is hepatitis B, for example, transmitted? If you don't even mind, if you can give us how all these hepatitis types are transmitted.
So for hepatitis B, it is actually transmitted through blood. If I can maybe sum it in a summary, because we may not have time to delve into. So if you look at the mode of HIV transmission, it's actually similar to how hepatitis B is transmitted. So it can be transmitted from a pregnant mother who has hepatitis B. The pregnant mother can actually transmit the virus to the newborn baby during birth. Then also it can actually be transmitted through the use of contaminated sharp objects like razor blades, shaving machines, the safety pins, and all those other, equipments that are not sterilized at the time of use, when they have actually been in contact with the blood of an infected person. So it can also be transmitted through sexual intercourse, especially if one person has high copies of hepatitis B viruses in their bloodstream, there can also be a transmission through that kind of route. But there has been a lot of interventions the Ministry of Health has been doing. So in 2002, the Ministry of Health introduced what we call the pentavalent vaccine, which includes the hepatitis B vaccine. So this is given to all the children that were born below, I mean after 2002, as long as their mothers have taken them for immunization. So this can actually be taken in a period of after six weeks from the time of birth, then 10 weeks and 14 weeks. So once these children have actually received all those doses, then they are protected against hepatitis B. But because we have that window of 6 weeks, especially for the pregnant mothers who are positive, there has been, there can be high chances of transmitting the virus from the pregnant mother when they are giving birth to their newborns. So as of last year in October, the Ministry of Health also adopted another new policy that is actually giving an opportunity for all the newborn babies to get vaccinated within 24 hours of birth. So most of the transmissions for hepatitis B actually happen and become chronic or lifelong infections when they are actually gotten from 5 years and below. So if children are actually protected within that period, 5 years and below, then they will not have the chances of contracting hepatitis B in the future. And therefore, by that, we shall have a free future of hepatitis B generation. Similarly to hepatitis C, the mode of transmission is actually similar to that of hepatitis B. The only difference that appears in these two viral infections is that while for hepatitis B we have a vaccine that can prevent one from getting hepatitis B virus, for hep C we do not have a vaccine, but rather we have medicines that can actually cure the hepatitis C virus. So hepatitis B for now is not curable. So those patients who are put on treatment, they are put on treatment for lifelong, for the rest of their lives, for now. But we also understand that there are so many studies going on in those high-income countries trying to develop a functional cure for hepatitis B. So that is work in progress, but for now, if someone is diagnosed with hepatitis B, they will live with this infection for the rest of their lives. And also it is very important to note that not everyone who has hepatitis B is actually put on treatment. So if someone has actually been tested for hepatitis B, they need to see their doctors, and then they need to do a series of investigations or tests that will then help the physicians, the doctors, to decide whether these patients are going to be put on treatment or they are not going to benefit from the treatment.
Okay, and let's look into the impact this has. Of course, every disease has an impact. Yeah. Every viral infection has an impact on the many. But the fact that, hepatitis is something that we've been, having on media platforms, we see engagements of various health experts going to schools, going to communities, making sure that they give information to the people on how to deal and how to prevent, of which I really also want to understand. How then do we prevent this from a personal level?
Yeah.
Because I don't want us to only look at it from an angle of, let's say, the health sector, but how can a person, an individual like myself, deal with the prevention bit of hepatitis?
Yeah,
any hepatitis type.
Yeah, so each viral hepatitis infection or virus has its own preventive measures.
Okay.
But before I can delve into the prevention bit, why are we concerned about hepatitis as a public health issue? So hepatitis can actually lead to complications like liver cirrhosis or scarring of the liver, liver damage. It can actually cause complications like liver cancer. Someone can develop liver cancer. And 85% of liver cancer cases registered at the Uganda Cancer Institute are as a result of hepatitis B alone. So you can imagine how impactful this public health issue is on the community. And you well know that cancer is one of the most expensive and painful diseases that we have. So for one to actually have maybe another chance to live if someone has been diagnosed with liver cirrhosis or scarring of the liver or liver cancer, the only option for that person to live is either to do a liver transplant. And doing a liver transplant in India costs about $40,000 and above. And this is a lot of money that most of the Ugandans may not afford. So that's why it is very important for people outside there to test and know their statuses about hepatitis B, hepatitis C, so that they can take precautions. Because if someone actually gets to know that they have hepatitis B early enough, there is medication or preventive measures that can prevent you from advancing to those liver complications like liver cirrhosis, liver cancer, and even death. So it is very important that we take this as an important disease and also know how we are standing with hepatitis B as the health. So what we talk about, I mean, the prevalence of hepatitis B actually in the country is about 4.3%. So you can imagine out of the 45 million Ugandans that we currently have, you can do the maths and see how many Ugandans are chronically affected with hepatitis B. Unfortunately, majority of these people do not know because hepatitis B sometimes is asymptomatic. Most of the people do not actually exhibit the signs and symptoms when they have hepatitis B until you get to those advanced disease stages of hepatitis. That's when you can begin to show the signs and symptoms. And again, some of the signs and symptoms are almost identical to those of malaria, typhoid. So someone can feel those malaria, typhoid symptoms and signs and then think they have malaria or typhoid. But when they get to the health facilities to test, and they don't have malaria or typhoid. So it is very important that we also take keen interest in knowing our statuses for hepatitis B and C. So the modes of prevention for hepatitis B, for instance, like I said, the most effective way is through the vaccine. There has been a vaccine for the last so many years, and I'm glad that the Ministry of Health has taken the campaigns to provide free testing and vaccination for the adults starting in 2015, and it is still ongoing. But the response has actually been very low because majority of Ugandans do not know more about hepatitis B and the impact it can cause on their health and their economic.
Now, on that matter of very few Ugandans knowing the impact it has or what hepatitis B is all about, let's look into the programs of awareness. What, for example, have you been doing? What do you think the ministry should do in the long run? And also making me understand, what is the organization, especially for the people with hepatitis B, what are you doing? What programs are in place to ensure that, well, we get to know of how to deal, how to prevent, how to treat, and how not to spread?
Yeah, thank you so much. So the National Organization for People Living with Hepatitis B, an organization that I lead, started realizing the burden of hepatitis B way back in 2012. That's when it was formed. So at the time, there was no public awareness about hepatitis B, even among the health workers. They were still very ignorant about hepatitis B because at that time, there are so many challenges like the stigma, discrimination because of the surrounding myths and misconceptions about the mode of transmission for hepatitis B. So at that time, we ensured that we used the patient lived experiences to share with the public through the media, through workshops with the religious leaders, the cultural leaders, and even the members of parliament, especially those from the high endemic regions of West Nile, Acholi, Teso, Karamoja, and also parts of Western Uganda where the prevalence has been actually noted to be very high. So with these engagements, we were able to also convince the government of Uganda to put in place mechanisms that can address hepatitis B as a public health issue. And in 2014-2015, for the first time in history of this country, the Parliament, through Ministry of Finance, was able to allocate 10 billion shillings towards the hepatitis program. And that is when the Ministry of Health now started, implementing programs like adult screening and vaccination, and also trying to do training of health workers, and also establishing hepatitis B clinics. Because before that, when we established the National Organization for People Living with Hepatitis B, there were no dedicated clinics at hospitals, even regional referral hospitals. There were no clinics. So as we speak right now, the Ministry of Health has actually designated hepatitis clinics at all regional referrals and also general hospitals, and health center fours are also able to manage hepatitis B. But because there is no foreign funding or external funding that comes through this program, we are leveraging on the existing HIV structures, because most of the HIV structures can actually help in the management of hepatitis B. For instance, the medication, part of the HIV drugs actually treat hepatitis B. It is just a single component called tenofovir within the HIV combined therapy that treats hepatitis B patients. So in the absence of a monotherapy or a drug that is specific to hepatitis B, health workers have actually been utilizing some of the HIV combined therapy to manage hepatitis B patients that are eligible for treatment. But this is an appeal that we need all the stakeholders, especially PEPFAR, Global Fund, and also Gavi and other key international partners to also consider supporting hepatitis B, because it is a disease of public health interest in Uganda, and dealing with it in silos and also creating vertical programs for HIV only or TB makes us lose that opportunity to strengthen our healthcare systems. Okay. So it is my appeal that partners look into hepatitis and other related infections like hepatitis C to ensure that we have a public health approach that will actually benefit Ugandans to live a better life.
Okay. Now, speaking of ensuring that Ugandans do live a better life and life free from hepatitis, the World Hepatitis Day is 28th of July. Now, take us through the celebrations. Where is Uganda celebrations going to take place? What are you aiming at this very year? And what is the theme that will be taking us to the next year of 2025?
Yeah. Thank you so much. So like every 28th of July is World Hepatitis Day. It is one of the official WHO health days, and Uganda, being a member state of World Health Organization, will join the rest of the world to commemorate World Hepatitis Day. And this year's theme is Take Action, Time to Act, because for so many years, there has been tools that can enable us eliminate hepatitis, but there has not been serious action that has been taken by member states. So the theme for this year is actually reawakening member states to take action and make sure that they actually advance, because WHO has given targets to member states that by 2030, hepatitis should be actually eliminated. They have set targets, and Uganda is also, supposed to achieve those targets. So this year's celebration will be in Kumi, and the guest of honor will be the Honorable Minister of Health, Honorable Dr. Jen Rutha Cheng, and we welcome all the people in that region, the Teso region, to utilize this opportunity, because there will be a number of activities, screening for hepatitis B, vaccination, free vaccination for hepatitis B, but also an opportunity to call upon your leaders, your members of parliament, because these are the people that appropriate budgets, to ensure that there is at least an addition of funding to the program, because like you asked me, the awareness of hepatitis B in the communities, even amongst the health workers, is still very limited. So we need more funding from government to ensure that we create massive awareness for people to understand how hepatitis impacts on the general public and also on the economy itself. Yeah, so that's where the celebrations will take place, and we shall be there with people from that region, and also we welcome partners who might be interested to showcase what they are doing in the health care sector for Uganda, and specifically for hepatitis B.
Okay, and I have a comment coming in from a viewer who's saying, good morning, thank you for hosting the gentleman. He's for hosting a lively gentleman. He says he's a true mentor and a doctor to us. I'm tuned in. This is Buambale Yunus in Kumba. Thank you very much, Buambale. This says, I'm listening and watching in from Bududa, but I think we need to strengthen the systems like we did in HIV. I have a neighbor who has an adolescent daughter taking HEPSB medication, but most times she's off drugs because of her boarding life. She says she faces a lot of stigma from friends. Then I realized for 2 years she didn't have a viral load, but the clinic where she takes drugs from doesn't even follow up. Very critical one here. This is from Namono.
Yeah, Namono, thank you so much. So, yeah, of course, there are challenges. Like I've said, there is limited funding for hepatitis, but we are trying to work with partners and Ministry of Health to ensure that at least there is an increment in the budget allocation for hepatitis. There has been free viral load for hepatitis B testing. It is done centrally at the Central Public Health Laboratory in Butavika, and they are utilizing the hub system for the HIV program. So they draw the samples from wherever they are, and then they ship them through the hub system. And I think Namono should utilize the health facility that has that hub system in place to ensure that they can take the sample for the patient and then ship it to Kampala for the viral load testing. Yeah, of course, we appreciate all the Ugandans who take their time to listen to such programs, because sometimes we find ourselves in issues that sometimes do not add value to our lives, and listening to programs like these, I think will improve the health of Ugandans, because they will take precautions on what they are supposed to do and what they are not supposed to do.
Okay, and what would be your parting shots to our viewer this morning?
Yeah, thank you so much. So my parting shot basically is to appeal to all Ugandans, inform them that hepatitis B is a public health problem, and it does not discriminate. So it is very important that you know your status today, because when you know early, then you are able to manage yourself. Like I said, hepatitis can cause liver cancer, and you know how expensive cancer treatment or management is in our country. So there is an opportunity for a vaccine that is readily available, and there has been attempts by the government and Ministry of Health to disseminate these vaccines to all public health facilities, but the turn-up from the general population has been so low, and even those that get their first dose do not complete all the 3 doses. So if you're outside there, you have received either your first dose and you have never gone for your second and third doses, it's high time that you think about going back and receive all those 3 doses. And if you are outside there and you are tested for hepatitis B and you are found positive, that is not the end of the world. You need to go back to the health facilities and get evaluated, because WHO has come up with new guidelines that might actually benefit you to benefit from the treatment.
Okay.
And that is all that I can say to Ugandans, and thank you so much for hosting me.
Lastly, I have some comments here, and I would want us to run through them very fast. This one says, Isaac from Kasese. Thanks, Kenneth, for the tremendous work. He says, just inquiring, what is the current statistics of the victims of hepatitis B in Uganda? Thanks if you do have some record on that. And Robert Nwagaba is still asking, what are the main causes of hepatitis? And then lastly, we need his voice on hepatitis cause in Kasese district. This is Wambale, who is currently in Kumba. So I think we take one when it comes, this one was saying what are the main causes. Robert, I think he just joined us.
Yeah. And
then the last one was saying some bit of the statistics.
Yeah, so the prevalence of hepatitis B in Uganda is about 4.3%. So they can do the maths, 4% of 45 millions, then you'll know how many people are affected with hepatitis B in this country. The other one who's asking about the voice of, that I need my voice in Kasese. We have been to Kasese to implement a number of activities, training VHTs on hepatitis B, like identifying those people in their communities and linking them to health facilities. We have been able to lobby the ministry to bring in more vaccines to Kasese. And as we speak right now, there are vaccines in most of the public health facilities in Kasese. So people should actually utilize that opportunity to go to the public health facilities to get themselves tested and vaccinated against hepatitis B.
All right. And just a quick one here, some few details as well coming in from the statistics. According to the World Health Organization, Uganda is classified as a high prevalence country for hepatitis B with a prevalence rate of about 4% of hepatitis B. And this is details from the World Health Organization. But of course, you get to realize that the same report was released by the Ministry of Health as of for the 2018-2023 period. So with that, with the current situation, you get to realize that the numbers are really relatively high, and we really need to come together to put an end to it. But on the 28th of July, please be part of the World Day celebrations. But Uganda celebrations will be then on the 2nd of August next week. I've been having Kenneth Kabagambe, who serves as the Executive Director of the National Organization for People Living with Hepatitis B, and our conversation was rotating around hepatitis and also looking at the World Day of Hepatitis in Uganda generally. I'm Joram Paul Sonko. I've been in here for Chirabo Robert Nyonyi Ntono, Olive Monica Najuma, as well as Chantal Oliver Kaninda and Ruben Pima Chibirango. For the team, Good Morning Uganda. Tomorrow is Friday, and we shall be having the Good Morning Uganda Friday edition, so be sure to catch up the show tomorrow as we kick start off from 6:30. For now, have a good morning and a good day.